Now we have several options for so-called screening or for first stage testing. We can do lab tests with the ELISA tests in the labs. But also rapid tests are available since recently. But the biggest problem is why we cannot identify the patients is the nature of chronic viral hepatitis, which is usually a asymptomatic disease. So most people don't have any symptoms. They don't complain to doctors, and the chronic hepatitis develops until liver cirrhosis or cancer when it's already too late. And when there are no targeted screening programs, when the doctors, when they don't test on purpose, when they know that this group of people probably has a high prevalence, that they should test them targetedly. Then when it doesn't exist, then these people remain undiagnosed. In 2017, WHO has published its first hepatitis B and C testing guidelines, and there also there are the groups of populations which should be offered testing are also identified. So first of all, in the countries where there is low prevalence, then there should be people who have from the groups with a high prevalence or with a history of risk factors, so people who were received transfusions previously or who were exposed to surgical operations some 20 years ago, they should be offered testing, for example. But in the settings where there is a high prevalence, when there is like 5% of the population is infected, we also have some countries like this, like Georgia or in other parts of the world, Egypt. In those settings, the WHO recommendations says to offer testing for everyone, because there will be a high case detection rate, and that would be a cost-effective screening strategy. The strategy, which was adopted in 2016, has set very ambitious goal, and many people were questioning whether it would be possible, because it was very. It looked like it required a lot of resources and a lot of commitment. But now we could say that slowly there are more and more countries which where first of all the strong political commitment appears, and when they are able to scale up the necessary services. So we have already a few countries where we can see that the goal of elimination can be achieved even faster than in 2030. Of course, there are countries which are still lacking behind, and mostly because of the lack of commitment and or lack of resources. But the situation changes so rapidly, and in Europe, I can mention countries like Portugal, Iceland, and also maybe Romania now takes very strong action in response to viral hepatitis, both in wide-scale screening and also quite a big program of treatment. It's one of the biggest programs of hepatitis C treatment now in Europe.